All right. Welcome, everyone. We're excited to have you here with us today for proactive approaches for supporting school challenges in a virtual world. We appreciate you joining us. And so we'd like to introduce ourselves to get started. I'm Sarah Plunkett. I've been an SLP for 17 years. It's always wild to do the math on that. Have experience in a variety of settings, including here at Eluma for a couple years before transitioning over as a clinical services specialist for speech language pathology. We also have Cami Bible, an OT, and our clinical services manager here at Eluma moderating the chat and helping us behind the scenes today.
Yeah, and I'm Kay Kelly, school psychologist. I always say it's easy to do the math if I follow Sarah because I'm 1 year behind. So I'm 16 years school psych in the Midwest in Missouri and Kansas.
All right, we've got a poll coming up here. We'd love to know your discipline. Always like to see the mix there. Wonderful. Got usually have a lot of SLPs for sure.
Yeah, which is good because I feel like they're the chattiest.
Me too, that's right. Awesome. Looks like a good mix here. Wonderful. Thank you guys for sharing that. We've got some OTs in the chat too. Wonderful. Thanks for sharing. And how about the type of schools that we're working with? This is always usually a pretty good mix too, so I love to see this as well. Some public and charter schools there, and then we've got some that are not in the schools. And this is fantastic information for everybody today, so we appreciate that. And this is another good one. I always love to see the mix of these as well. What about our grade levels? I think this, again, is important information for everybody. So it looks like we have a little bit of everything today. That's great. And you guys are so fast with Slido. This is also fantastic. Sometimes
I
it
know.
takes a little bit to get in, but this is great. This is great. And then this one we love to see, and here's a nod to the wonderful Catherine O'Hara. Where do you rate your knowledge of supporting all tiers in virtual sessions? We're going to kind of come back to this at the end. So we always love to see these comparisons of this is, an interesting topic for all of us, and there's a lot of information within these. So we're going to get into some good things today. Pretty good mix here as well. Wonderful. Well, thank you guys for sharing and kind of engaging with us to get started. Here's what we're going to learn about today. You can find these outcomes listed in your handout. As an engaged participant, this is the knowledge that you will walk away with at the end of the workshop. You'll be able to describe 2 adjustments to improve or prepare for challenges in school-based teletherapy sessions. Also identify 3 tier 1 and 2 behavior strategies for working through challenging sessions, and then list 3 proactive strategies for preparing students for teletherapy sessions in the school environment. So we're going to get started. We do have a lot of material to cover. We want to make sure we have time to cover it all and also answer any questions that you have. So we're going to start with a quick Slido exchange. Again, kind of rating what you're most excited about to learn today. Don't worry, we'll get to all of it, but we do like to see what you're excited about. Wonderful.
That's good news. Tier 1 and Tier 2 tend to be the easiest to access. They're pretty routine and sometimes free even. So those are the good classic ones. We will be covering those today.
Awesome. Well, this visual might bring up kind of some memories of different sessions that stick out in our minds. Some mental health providers and staff really might, other staff might be familiar with the analogy or strategy or of considering both sides of the same coin. This can apply to the challenges that come up both in person and in teletherapy. There's another side to these challenges where we can really build skills and role model patience and dependability to our students that can help them set goals, persevere through challenges, and reflect on the importance of difficulty that is just a part of sessions and school and life, really. And so situations where students who challenge us in sessions, that can be difficult. Those students are not always even best served in teletherapy, but as the saying goes, smooth seas don't forge strong sailors. And so once we can process these challenges ourselves and kind of process these challenging cases, we can reflect and see that we have built positive skills, and those skills are just going to serve our students better in future sessions. So, really important things to think about there for sure.
And we're going to really jump in straight into sessions. So, starting out, we're going to look at some things that we can do in sessions, some strategies, and some more frameworks that you can kind of start looking at, maybe something for today that you can use today through the end of the school year. 'Cause we're kind of coming up into spring, so we're all kind of in a mindset of closing out. But today's a good day to kind of try to find one strategy or component that might work to attempt between now and the end of the school year. We have students with mental health issues, anxiety and depression, and difficulty with social connections and stress management. And that all plays kind of a role in their tolerance for engagement in our sessions with us. When I know a lot of the related service providers out there, they do such a good job with all their content. There's lots of avenues that we can look at increasing skills at. And today we're just going to focus on social emotional learning as one way to kind of build up a skill set, maybe pull a few strategies from today, from this hour that could work for you, and kind of utilizing social emotional learning components as a long-term way to mitigate positive behavior change, kind of a long-term benefit for us. Starting out, really the first one is that catch 'em strategy. That's the positive validation or positive feedback that we give to students. Catching them doing what you like them doing, meeting the expectation, and then kind of passing it on to a trusted adult is a really great strategy to use for students. Positive feedback is so wonderful at validating really specific behavior expectations. And I know it works great for students because I do it with adults too. As a school psych, I'm out in the classrooms quite a bit, or when I was on campus, I was. And I started taking notes. School psychs, we love a really solid tier one. So in the high school, like secondary setting, we would really want to increase those Gen 1, Tier 1 strategies. And if I was in a classroom, I would take a couple notes to see if there was something the teacher was doing that was just meeting expectation. And then afterwards, send an email to their building admin or their evaluating admin and them and just say, like, you're doing a great job. I was in there, I saw you doing opportunities to respond, and that's great work. That little bit of validation can really build a reoccurrence of that happening again. We do have some blanks on your participant worksheet. So if you're following along on that and you want those answers, one of those is learning. So SEL learning in sessions. I think one way to kind of build in either a framework or just a few strategies is working with trauma-informed practices. They work great for virtual. Um, Trauma-informed practices helps kind of build an understanding of secure, safe, stable environments, which is really beneficial for the tele environment setting. And then within that, a lot of their strategies are around managing overwhelming feelings, normalizing reactions to stress, and finding solutions, having students find solutions for themselves. So it's a great fit. And it works. It has so many great resources. I only put a few on the slide, but we did link the ASCA toolkit, the Trauma Informed Resource Toolkit, to your participant worksheet. So you can look through those to see if there's additional ones that might work for your current setup. The one that I like the most, this one's a little bit more immersive. So if you're looking to take some of your IEP goals or content and kind of build it into trauma informed, bibliotherapy works great. That's that literacy-based concept. So bringing in storybooks and that have messages around calming strategies or breathing technique is really helpful. So it could work really well. I know we had a lot of SLPs in the audience, and you guys do great at literacy-based work already. So finding books that have a high frequency of a particular articulation sound or working with that expressive language, but also has that message of SEL learning can be really beneficial. If you're not ready to go fully immersive, just bringing in a few relaxation techniques takes about 30 seconds, even less, if we're doing some of our smaller children. So those can be at the beginning or at the end or kind of just bookending. But those are great ways to help students bring in practicing kind of calming their body and work really well in a telesession style. We do have questions that populate throughout the whole webinar. And so this first one, you just have to put your name in, and then you'll have access to all the questions through Slido, but you can also put them in the chat. So when considering content for teletherapy, which factor is crucial for preparing for challenges and improving sessions? And Sarah, I think if you do one more click, they can see question. There you go. Incompatible technology, lack of cultural sensitivity, engaging in relevant material, or ignoring data privacy and security. Very good. All right. Before we kind of get into like a full cycle of student and staff or provider responses, I wanted to have just a couple slides to kind of talk about theory. There's a couple theories up there, and those are always helpful to have just a mindset about challenging behavior. That first one is Maslow's hierarchy of need. That's really common in school bases and school communities, and that's kind of where a student's capacity for learning and achievement is kind of higher up on the pyramid. And it's a principle that states that to be at that level, first, they're going to need their basic needs and safety and emotional care accounted for. And then additionally, they're going to need connections to others. So we do have students who come to school in session with us, and they have impacts in those basic needs for safety or care. So they could come to school hungry, or they might witness or experience violence the night before. And so those can have impacts in their tolerance for engagement and learning in your session. That middle one there, that's HALT, which you might hear. That's kind of like a setting, event, trauma-informed care infusion piece there. But it's a great acronym for trying to have a mindset of thinking, where are students coming from or what are they coming with? So setting events are kind of those factors or variables that increase the likelihood that a student might have a difficult problem. And then trying to find the root cause of it. So an example might be like a student who takes medication to, aid in sleeping, perhaps didn't have access to that medication. The family had financial hardship, and now their quality of sleep is impacted. So they're coming to school maybe more tired, and that could be a setting event or vulnerable unmet safety care. That last one there, that one's adverse childhood experiences, and sometimes we'll hear that as ACE or ACE scores, and that's because it comes from a particular questionnaire, a medical questionnaire, where students are the person kind of completing the questionnaire is endorsing whether or not they had these exposures to these adverse childhood experiences. And those adversities include like physical, sexual, emotional neglect, abuse, substance abuse in the family, domestic violence. And then they're having these study correlations where the number of exposures you had kind of correlating to some school outcomes. And for students experiencing 1 to 3 of these, they're already at a risk for impacted social connections and poor school performance. And then if they're experiencing 4 or more, a pretty higher negative correlation to those negative outcomes. If you're following along on that participant handout, that blank is Maslow's. This second slide, kind of about theory, is regulation versus dysregulation. So regulation is kind of that state of being where an individual or a student's going to feel pretty safe and present and engaged. And they can definitely still have behaviors that are non-preferred, but they're regulated. And so they're able to respond to some tier 1 stuff like redirection, just a natural relationship with the student, maybe a tier 1, tier 2 support, which is good because we're going to have the students coming to us and they're coming from mindsets and environments that can be elevated. And then they're coming into our sessions. So it's good to know that we can meet them where they are and keep them regulated. We have students that continue behaviors. They might be kind of unresponsive to the supports that we're trying to provide for them, and they could enter a dysregulated state. Dysregulated students struggle to activate their frontal lobes, which is that front part of your brain. It kind of is your executive hub. It's there for processing information, reasoning, reflecting. So the difficulty in addressing dysregulation is kind of further exacerbated. We don't have the same tools online to do that internally as a student. We do sometimes see that manifest kind of in the flight, fight, freeze categories. So you might hear that pretty common in the schools. That's where it could manifest in different emotional reactivities. So if a student was to show maybe signs of flight, that would be similar to like eloping or kind of leaving the situation. Fight might involve some emotional reactivity of elevation or aggression. And then freeze could be kind of like a disassociation or like an isolation from the task. And this happens in telesessions too. So we might see a student who refuses to initiate work for us. That could be a sign of freeze. We might see a student react really quickly to a typical stressor or even just a typical session request. So an example would be a student, maybe you ask them to, put their phone down during session, a pretty typical request that you might expect to come up in telesessions. But a response from a student who maybe immediately yells or uses profanity at that moment, that could be a sign of fight. And then a student, just cameras off or logging off could be a sign of flight. We also, unfortunately, is not just a vacuum for students. Regulation and dysregulation is something that happens to providers too. We can get that sense of freeze, flight, and fight when students display challenging behavior, or particularly if it's really disruptive or unsafe. You can kind of get that sensation internally as well. And just knowing that this is going to happen and building up adult self-regulation skills is a benefit for the full cycle that we'll go over in a couple of slides. The iceberg analogy, which is on the slide there, again, really familiar, but also really helpful. It does a really good job visualizing that there's more than just these difficult problems on top. We have these underlying needs that we can kind of explore to get at the root cause. So if we're really just trying to manage those top ones, we're going to miss a real big need below. If you're following along on your participant handout, that word is fight. Okay, so we're going to share another a slide of some strategies here, and then we'll have a couple questions following up. This first, and this is not like a honey-do list, so there's no need to try to do all of these starting tomorrow, but maybe just finding one or two that work for you. Doing them routinely or doing them with intent is kind of where that magic comes in versus trying to do them all. The first one is visual routines and timers, visual timers. For a student who maybe isn't displaying any of those, tip of the iceberg behaviors, they could still be experiencing something underneath. And predictability that we can do in our session layouts by having visual routines and timers really does help uh, provide that sense of safety for some students. Social stories are great. They're really great at reinforcing a behavior expectation. So if there is something you wish was different, maybe in a session that you're with a student or in a group session, turning those into social stories is a great way to do that. Building genuine connections. I think school-based providers hear this all the time about relationship building for strategies. And like I feel like the school-based providers are kind of the best at it naturally. They tend to have really great connections. It comes really naturally. Every now and then we might have a student who maybe we have to do some intentional relationship building with. And so I put a few on there. The 5-to-1 ratio is still a really great strategy if we're doing one critique or negative kind of feedback, kind of pairing that with 5 positive, genuine statements to the student. And then the 2x10, that's another great method for building relationship. That's where you're taking 2 minutes of time and having non-academic talk about it. So we're not talking about goals or school. We're kind of just having a more connected conversation. And we're doing that for 10 days straight. So it's just a nice way to kind of build an opportunity to listen, which we don't always make time for in our sessions. Momentum of success. That's the last one. That's probably what I use the most often. And this is where we're kind of allowing a student 2 choices, and then they initiate or take action by choosing those, which is really nice. Motivation sometimes gets misunderstood as desire or willpower, kind of like that internal boost to do this step, but motivation is coming from the action of doing the first step. So that once we kind of get them taking action, that motivational boost can help us with momentum of success, getting through refusals, challenging work, starting something new. That's a great time to use it. So these are all tier 1, tier 2 supports. And the magic part really isn't doing all of them. It's just doing them with intent or doing them really routinely. We have some back-to-back questions, and we will see if we can get those questions populating on your side. I think I saw that on the chat once when I was reading through. So which of the following is listed as a tier 1 and 2 behavioral strategy for working through challenging sessions? Avoiding social stories, ignoring student voice, using visual timers, or engaging in a one-to-one. Very good. Okay, I'm glad that's working.
Sorry, guys. I think on the first one, that was me, and I got a little too excited on my forward path here.
That's all right. Thank you, Sarah. And we have a back-to-back here. So this is true or false. The 2x10 conversation is a recognized tier 1, tier 2 behavior strategy to foster genuine interest in listening. True or false? Very good. All right, I'm going to kind of work through this one here. This is navigating challenges. So there are just days where we have a difficult case, and all the proactive strategies and all those tiered strategies and all your experience and all your dedication, they just don't meet the needs of a student in a particular moment that's difficult for them. And so when this happens, the best strategy is to manage yourself first. If we can have the adults staying regulated, that kind of keeps you in your executive hub. So we have a driver in the captain's seat up there is really important. We don't want to be in a driverless car in this situation. We want that human connected driver. So maintaining a calm and supportive demeanor, just as the provider, in itself is a really great tool to have. But in addition to that, if you wanted to try to work through or kind of process through a challenge in real time, I have just a few here to consider. The first one is clarifying a student perception. You're just kind of trying to understand the reason behind. Sometimes I think using the word intent can be a helpful language switch to get at their point of view. Um, but having that, working through that process, and kind of noticing out loud if you've seen a dysregulated behavior can be helpful. And then we will always want to be thoughtful that we're reestablishing or that we're maintaining that working relationship. So I know we had school psychs and mental health in the audience. This is kind of part of that process that we do when we have students, and what we work through in content, but we also have related service providers who, like the SLPs and OTs, you guys have content that you're getting through, and sometimes these behaviors are coming up, and having that process time impacts, how much access you get to have them for instruction and IEP goals. So it can be tricky. The I think I have two on here, Sarah, if you do a click, but I'll just do that first one. I'll just do the engage one. So for just an example, if we had a student who's maybe refusing, it's helpful to kind of discontinue that demand. So if you're in a task, uh, kind of discontinuing it. If you wanted to proceed with a processing of it, kind of noticing that out loud. So you could say like, I notice you're quiet today. Offering that choice kind of gives them the action step to have a move forward. So you could say like, I noticed you're quiet today. Let's take a moment and be quiet together and see if I can better understand. Do you want 2 minutes or 4 minutes? And so kind of putting it into that little framework can help hopefully get through the processing of that emotion or that moment, and over time lessen and lessen. We do have some students whose need for processing happens pretty frequently. And so it can have a real impact in your ability to access them for the amount of time that you're serving them, say on an IEP or towards a particular goal that you have set for that year. And I think, that question comes up, like, what happens if you don't feel like the student's getting what they need because it's through teletherapy or because it's on this type of platform? And I think being a school-based provider is the best um, kind of resource for this because you get to lean on team decision making. You don't have to kind of navigate that all by yourself. You can bring that to the team and say, like, over the last 4 sessions, 4 weeks, I've only had actually 10 minutes of instructional time towards my IEP goals in speech and language. It's due to these kind of amount of time that's going through these challenges. And then you get that team approach to kind of say, well, what resources can we do? What solutions do we have? Do we need to adjust the goals because we're not going to make them? Do we need to adjust the frequency or duration? Do we need to pull in mental health supports to kind of help lessen the amount of this processing that it's taking? None of the strategies today, unfortunately, have like an instant work, and a lot of them work the best over long term. So just like routine, predictability, expectation setting, and so it's a real long-term game. And so there might be times where you're not seeing it for a while, but at the end of the day, I guess what this slide was saying, like leaning on your team, is what I think is the most helpful when we get to that really prolonged, really impacted, challenging behavior. And then we have a question coming up. So, which of these is a listed strategy for tier one and tier two interventions? Disregarding student strengths, ignoring visual routines, momentum of success, or avoiding genuine interest. So we got a lot of fast answering here. That's good.
You guys are good on the Slido today. It's awesome.
Perfect. Okay. We're going to go through, kind of just walk through a student and kind of provider phase. So this is like a phase of de-escalation that you might see for a student. And it has the student going through it, and you also have the providers in the green kind of going through it. And our tools, they do adjust a little bit differently, kind of based on the phase, but what doesn't change is trying to maintain self-regulation. It definitely is a skill set. Sometimes it comes naturally, but not always. Like sometimes spending some time building up our own self-regulation can be really helpful, um, particularly in elevated times. I think we have two resources on your participant handout. So we have the PBIS habits of effective classroom practice and don't discipline hangry are on there. And then I just recently went to one called the regulated classroom, and it was all for school-based adult self-regulation, and it was really good. So that's another resource to look into. But we will just kind of go through the phases here, and we'll start in prevention. So in the prevention stage, this is great. A lot of your tools are going to work in prevention. Your students are regulated. They might be ornery or do a couple behaviors you don't like, but they're really responsive to redirection and support. This is a good phase to welcome role modeling. So if you're wanting to practice any type of, crisis response process, like you're in a social group and there's been a crisis and now you need your group to go to a breakout room. You need all but one student to be in that room with you. You can practice breakout rooms. It's a good time to practice those social stories if you're working on a behavior expectation. Great time just for IEP goal learning because students are just highly activated in their frontal lobes when they're regulated. So it's a really good phase for a lot of tools. When we move to escalation, this is kind of where you might see a student show like agitation in some kind of sense, like maybe it's verbally or non-verbally. Um, they still have kind of that fleeting activity in their frontal lobe, but it's fleeting. It could go either way. So we want to be really thoughtful about our own self-regulation and the tools that we use if we see a student elevating. Because they're not fully in their frontal lobes, if we give a bunch of verbal input or too many choices, it can really have a high cognitive load on that. And it could frustrate them and really send them into acceleration pretty quickly. So the tools for escalation for a provider would be really low language input. So maybe think yes, no questions, lots of process time. So being kind of comfortable with a little bit of silence is beneficial here. If you're thinking like, oh, I'm going to give him this question, do you want me to put some quiet music on in the background? You're definitely going to want to wait before you follow up on anything else. Just giving them time to process that and answer it. The next one is crisis. So crisis is kind of that peak dysregulation, and students are not accessing frontal lobe capacity. So they're kind of offline. They don't have those tools anymore. That might be manifesting in fight, flight, freeze. It can manifest in really highly disruptive behavior. It could go even farther outside of this type of cycle and go into emergency safety interventions. And so it's really elevated. And it's really essential. I guess I'll say it on all of them, but like having your own self-regulation during a stressful moment is really helpful because it keeps you regulated, being able to pull back some of your policy and procedure and reason, and trying to look for these phases so you kind of know which tools to use. In crisis, we're not going to be using low limits language, or it's kind of strictly supervision and safety. So this is a good time to kind of, if we're in a group, we need to, maybe clear out students and having them go to their own breakout rooms, um, asking our facilitator for support if needed be. This is really a supervision safety tool moment. If we kind of misjudge that, you'll know pretty quickly, I guess, because even if you think like, oh, I'm going to remind them to count down from 10, which is, kind of nice to give them that gentle reminder of something that works for them. But in crisis, that language will just go straight over them. They won't process it. They're not going to reflect on it. And it's going to keep them elevated longer. So before we kind of move into that recovery phase, it's always a little tricky to know when are we there. So your safety and supervision in crisis, calling in for support as needed, and you're kind of looking for like evidence that we're moving into this recovery phase. And we typically use like the 3 R's to gauge that. So we're looking for relate, regulate, and reason. So you might just see the student regulating, which is nice. And you can recognize that, like, thank you for finding a calm voice. You might want to relate. Maybe the student's getting quiet. You're not sure if it's going to, you know, re-trigger something, and you want to offer kind of a brief show of concern. You can be like, I know it doesn't feel good to lose control. Or reason. I always do reason before I go into recovery. It's just a nice way to check and see if that student's kind of back in the executive hub or that executive frontal lobe. And reason is not really a compliance check. It's kind of the form of a question, but it's not a compliance check. It's a cognitive check. So we just want to provide like a really simple, non-instructional, non-academic, maybe next step or direction, just to see if they process the language. So it almost doesn't matter what they answer. It's just like, oh, did I see them get that language? If so, we're kind of back online and we can go through recovery and restoration. Um, the restoration part is really beneficial. I know, like, as a provider, after crisis, sometimes you get a real big sensation of relief that we're in recovery and things are kind of going back to routine, and you don't really want to maybe open up that can of worms again. But that restoration piece is really helpful. It ties into what Sarah said at the very beginning of that this is the other side of the coin. And so if we don't kind of work through kind of closing this up and seeing the benefits or the learning that comes from this, then we're not flipping the coin and helping them in that part of it. The tool I did want to say, like, the tools for recovery um, is routine and compassion. Recovery is such a vulnerable little window. And so we want them to feel safe coming back into environment, and giving them compassion is a really beneficial tool there. The restoration part, that comes from helping them work through, like, is there anything they can identify that went wrong or something they want to change the next time, if this was to come up again? Do we have any do we need to repair a relationship? Do we need to return to a difficult task? Those are some of the things that can happen in restoration. Okay, I am going to cover emergency safety crisis, and then I will let Sarah have some time to talk about some of those proactive pieces. I wanted to say before we kind of get into emergency safety crisis, there can be some sensitive topics, It's not very many slides, but we do have some sensitive topics over it. And it always kind of feels a little different, just depending the variables around you or your loved ones and mental health. So if there is something a little distressful on one of the slides, you really do have kind of professional grace to, mute your camera or take a step back and take care of yourself. So this one, what I wanted to say is kind of the importance of having your crisis procedure in place and available to you to review pretty regularly. Because these moments happen kind of at any time. I've had them happen at any time. So like face to face, a peer told me one inside school hours, outside of school hours, and you want to be able to pull up those procedures pretty quickly. If you haven't reviewed them this year, like now's a good time. April is a really elevated month, and it's a really great time to just put on your calendar that you're going to review these, what your crisis procedure is, and just to be ready for it. On this slide here, in addition to just having a protocol cleared with your district or your school, there are a few extra things that you can do to be proactive and best prepared for a crisis. So some of those things include kind of reviewing your 988 and 911 services and those limitations, knowing how to Google your 10-digit emergency number for where your student might be at. You guys will be in different 911 area locations, so you don't want to call 911 from Kansas on a student in Colorado. You want to be able to call that 10-digit number that's attached to that emergency number. And then additional things you can do if you're mental health, like getting risk assessment training was extremely beneficial for me. It really helped kind of pull all those pieces together. So trained on the Columbia, but there's lots of others out there. If you're not mental health interventionist, but you do want to build up those skills, I think mental health first aid is great. I did it maybe 12 years ago, and I still use strategies from it. So that's a really great one. You might come into contact with personally identifying information or protected health information. And so if you do, just knowing those FERPA and HIPAA exceptions for safety. We do have highly sensitive information sometimes come from a crisis assessment or intervention. So we might have a student suicide ideation, and that really needs to be conveyed through a primary personal contact. So phone call or face-to-face telesession with the parent, and not through something less secure like an email or an educational record notice. I think if you're following along on your participant handout, that's 988 and in person. These boxes almost look the same because there's really not a lot of room for deviating when it comes to crisis response. It kind of takes strict adherence to those protocols. But the left side is at school and the right side's at home. And one little difference, I think, in schools is making sure you know who your in-person supervisor's supervision of the student's going to be. So like in a crisis response, typically if you're in person, you supervise that person and the student until crisis comes to you. So like that student isn't released to the bathroom, they're not released to go back to class alone, they're not released to go up to the counselor to get a risk assessment, they're supervised for safety. And in telesession, there's that little window. So you're going to want to know, is my facilitator going to be the supervising person? Who's going to be the supervising person until crisis responds? And usually all that happens pretty quickly. So it's good to know. You don't want those windows to be very large. And then at the home setting, one thing I think is helpful is kind of doing a check-in on their location. So it's really quick. You might just say like, Sarah, where are you working today? In your bedroom. Okay, are you at your mom's or your dad's? They might say like mom's or something. Who's at home with you? Maybe they say nobody. That's okay. If something was to happen, crisis or even medical, like Sarah has a seizure or faints, or she has a crisis, and I go into crisis response. I'm in the best spot for that now that I know that information. A pro As a proactive consideration for crisis management during telesession, what information should be collected regarding the student? Their favorite color, their class schedule, their emergency contact information and exact home address, or their preferred teletherapy platform. And you guys are so close to being done. I have one slide and a couple of questions left, and then I can pass it over to Sarah. So this part right here is all about debrief. Sometimes we do go into those emergency intervention protocols, and debrief sometimes is not always as robust as I hope it was or is. Debrief is that time where you as a provider get to recover. It also helps you kind of have time without judgment to look at the protocol and how things really worked out in session that day and see if there was anything we could do different to adhere to a really strict procedure. That kind of builds up that skill for set for that. Being prepared and remaining calm and responding is something that you get to give to somebody, and it's an important piece that you can give to them if they're in crisis. But reporting and debriefing with your school team as a provider is something that you get to have because to help kind of manage the emotional toll that sometimes these elevated sessions can take on a provider. Okay, and I feel like some of the questions are a little bit on and off again, so I'll give you the answers if you're following along on your participant handout. So it's not necessary to identify a facilitator or in-person contact as part of the building level crisis. True or false? It's not necessary to have somebody there to supervise for safety. Very good. And one more. Ensuring a secure and confidential environment for teletherapy sessions is a recommended adjustment to prepare for challenges. True or false? Very good. Perfect. True. I said I would give you answers, and now I just remembered that I probably didn't, but that one is true.
Thank you guys for bearing with us. The Slido is a little off on the timers, so I appreciate your patience with that. We have just a little bit before we wrap up here today, and this is talking about the proactive work that we can use to create the safety net for both, us as clinicians and also the students. So we're going to get into some of those considerations now. We want to make sure that our technology is, that's a big proactive, especially with virtual sessions. We want to make sure our internet is good, all of our equipment, touch screens, anything like that. We want to make sure we've got adequate functionality for any remote sessions. This readiness is foundational for support, including crisis intervention. As Kay mentioned, it's really good to know that environment. We've got to have a backup plan when things happen. So we need those backup plans. We want, to make sure we are prepared on the technology side. We also want to continuously reflect on ourselves. We want to know our strengths and weaknesses. We want to build our skills so we can be the best providers to, families, students, and schools. One thing we can look at is inclusive language. This is something that Kay and I have looked into a lot together and worked on a lot together. We do have resources in our participant worksheet here for you guys. And a lot of this goes into things I know many of us have been looking into. Ableist language would refer to words or phrases that discriminate against people with disabilities. These can be hurtful or offensive, and we want to look out for those. We could also make sure we're using trauma-informed language. acknowledging that many of our students, many people in general, are going to carry trauma into spaces that they occupy. And we want to be respectful and mindful of that. We want to avoid any violent language, and we also want to consider culturally appropriate language. We also want to, think about the term special needs. Many disabled people and disability rights advocates have explained, that these are basic human needs. Many people might need extra assistance, but that doesn't make the common human needs special. And so we want to consider that language that we're using as well. And if you're following along on the participant worksheet, that is inclusive language there. We also want to think about our environment. This is important. We want to limit distractions for our students. We want to make sure that everything is secure and confidential. Kay mentioned issues, in thinking about FERPA, COPPA, and HIPAA always when we're working with students. We want to make sure we've got confidentiality. We want to think about the student's environment, the facilitator that they're working with. We can give a check, kind of a tip sheet to schools and say, hey, we want to make sure we've got an appropriate environment for the student. We don't want to be during, lunchtime in the cafeteria, anything like that. We also want to consider our environments, our backgrounds, what's going on in our environment with camera positioning, headphones, things like that. We also want to make sure that we just have a welcoming entrance for students as they're coming into our environment there. And so we've got another question here. Ensuring a secure and confidential environment for teletherapy sessions is a recommended adjustment to prepare for challenges. True or false? You guys are on it today. That is true. And building relationships, Kay mentioned this earlier. This might seem kind of a natural thing. And as she mentioned, as school-based providers, that's a big strength, I think, in a lot of what you guys are doing in the schools. But we want to make sure that we are focusing on these things. There are steps we can take. We want to make sure that we are those trusted adults, that we are working on the connections with those students. This just lays that really great ground work for those connections and for the success of our sessions, really. We want to make sure we think about that intrinsic motivation for students. You might consider using a social contract that can help with student buy-in, regular feedback on the students' accomplishments, building that momentum for sessions, as Kay mentioned earlier. Your participant worksheet includes a link to supporting children's mental health from NASP, and this is a really great resource to keep there. So we have one more question here. Building a strong relationship in teletherapy involves which of the following? We've got the lack of predictability, infrequent interactions, consistency and predictability, or relying solely on intrinsic motivation here. And yeah, that consistency and predictability is very important. Just a couple other things here to think about. Kay referenced this earlier, but really collaborating with those teams, the school team, the IEP team. This is one of our greatest resources, I think, that we can utilize. We mentioned those relationships and really leaning into those teams and how we can support each other. And so this is just a really huge proactive step that we can take to work with those teams there. It's also important to understand, live online learning. It's not a one size fits all. We've got to plan, we've got to prepare. So this is just a quick slide to go over, introductory things you can, again, lay that groundwork, introductory meet and greets, providing that kind of meet and greet from a provider standpoint to let them get to know you a little bit better. All of those are really great resources. And I won't read this whole thing for you, but a lot of it, especially in the virtual environment, can be kind of mystifying those fears about teletherapy. We've got, national guidance from NASP and ASHA and AOTA that is saying, hey, teletherapy is, a great benefit for students, and it can lay out all of the reasons why it is effective and things like that. And so just a way for us to kind of address a lot of the myths that can still be out there, even though we've all been working with, virtual sessions and things like that for many years now. I think there are still some myths out there that we as providers can work again with our teams and kind of educating everybody on the teletherapy myth there for sure. And we've got one last one here. Proactive work includes considering which of the following categories to prepare for teletherapy sessions: ignoring technology advancements, disregarding the student-provider relationship, collaboration with school stakeholders, limiting content to non-engaging material. And yeah, we've got to work on that. Yeah, that collaboration with school stakeholders is the big piece there. And so quickly, we'd love to revisit this with our emojis here and see how you rate your knowledge after the webinar. We'd love to see, I know we were kind of in the middle, so it's nice to see that we've moved over a little bit there. That's fantastic. We appreciate you guys hanging with us today and appreciate your patience for probably user on my end with the Slido. So we appreciate that today. Just a reminder of the course completion requirements. We've got that in the chat to access that workshop evaluation and post-test. You'll complete the evaluation first, and then you'll be prompted to go to the next section for the post-test. And that post-test is required to be eligible to receive that certificate of attendance. So just a reminder of that there. Your certificate will be emailed to you within 2 business days. If you have any questions about this topic today, if you have any questions about anything, we're happy to answer at clinical services at elumatherapy.com. We will stick around so we can answer any questions that you have, or if anybody has any issues accessing any of the forms or anything like that, we're happy to stick around and answer any questions that you have. And we do have one last webinar this school year coming up in April, so we would love to see you there. It's going to be a great one as well. We've got free registration is available by visiting eluma.com. You'll just click on resources and then webinars. Thank you so much for attending today. We appreciate your attention to all this information. We've provided you with the knowledge that you'll need to identify those 3 questions for determining to talk about tier 1 and tier 2. And we'd love to talk to you more if you have any questions about any of these topics. But again, we are happy to answer any questions that you have. Good luck and thank you guys. I'm going to stop our recording now. But again, we are happy to answer any questions that you have. So we'll stick around to do that.